Patient's name Ramirez JJ, date of birth October 22, 2008, room number 329, physician Dr. Esplanada, doctor's order eye installation. So it is important to check the physician's order to ensure the safety of the patient. Transcribe the doctor's order in order for the procedure to be accurate. It is also for patient safety and to prevent from any errors. Hey, sir.
Good day, nurse.
So I am Anne-Corinne P. Tumulak, your student nurse for today. So today we will be performing eye installation. So eye installation is the medication of ophthalmic fluid or topical ointment into the cavity of the eye for a specific length of time. So the purpose of eye installation is to dilate or constrict the pupil when examining the eye and to relieve pain, discomfort, itching, and inflammation of the conjunctiva, and to act as an antiseptic in cleaning the eye, and to combat the infection, and lastly, to lubricate the eye. So, do you understand, sir?
Yes.
Taking the vital signs of the patient before a procedure can help determine the patient's overall health, and it can help create a baseline data. So, sir, I will go back to the nurse's station to get the materials and please do prepare for the procedure. Is that okay, sir?
Yes.
Thank you, sir. Go back to the station and gather the materials needed. Helps save time and energy. Patient's name Ramirez JJ, date of birth October 22, 2008, room number 329, physician Dr. Esplanada. Doctor's order neomycin and polymyxin B, sulfates and bacitracin zinc, neosporin, ophthalmic ointment, neomycin and polymyxin B, sulfates and bacitracin zinc, ophthalmic ointment, tetrahydrozoline, HCl, IMO, eye lubricant, tetrahydrozoline, HCl, IMO, eye lubricant. Perform medical hand washing to practice aseptic technique and to adhere to the principle of microbiology and to prevent from cross-contamination. Bring the materials to the patient's room to have an easy access in getting the materials and to save time and energy. Good day, sir. I am back. So, pwede na ko ibutang ang akong material sa bedside table.
Okay, nurse.
Thank you, sir. Sir, pwede ni mo i-state imong name?
Ramirez DJ,
Ang imong birthday?
October 22, 2008.
Okay, thank you, sir. So, sir, kanang okayhan ra ka sa imong position or ganahan ka mo sit sa chair?
Okay, nurse.
Okay, thank you, sir. And then, don't forget to put the towel on the patient's chin on the affected side, which is the right eye. To instill eye drops, first is to compare the medicine into the medication ticket. Tetrahydrozoline, HCl, IMO, eye lubricant. Tetrahydrozoline, HCl, IMO, eye lubricant. So, with a non-dominant hand, get one dry cotton ball. Then, gently retract the upper and lower eyelids to expose the conjunctival sac. To hold lids open, apply pressure to lower bony orbit and bony prominence beneath the eyebrow. Then, rest your non-dominant hand gently over the bony prominence of the eye and do not put pressure directly to the eye. Then, with your dominant hand, hold the field dropper with the ophthalmic medication approximately 1 to 2 centimeter or 1/2 to 3/4 inch above conjunctival sac. And then ask the patient to look up. So, sir, can you please look up? Hangad sa taas, sir. Then drop the prescribed number of medication drops into the conjunctival sacs. So 2 drops. 1, 2. Then apply pressure to the patient's nasolacrimal duct with the cotton ball for 30 to 60 seconds. Then dry the lids and facial area with the dry cotton ball from your non-dominant hand. And then discard the cotton ball. And to instill eye ointment, first is to compare the medicine into the medication ticket. Neomycin and polymyxin B, sulfates and bacitracin zinc, neosporin ophthalmic ointment. Neomycin and polymyxin B, sulfates and bacitracin zinc, ophthalmic ointment. So, with the non-dominant hand, get 1 dry cotton ball and then gently retract the upper and lower eyelids to expose the conjunctival sacs. To hold the lids open and apply pressure to lower bony orbit and bony prominence beneath the eyebrow. Then, ask the patient to look up. So, sir, pwede mo hangad ka sa taas. Thank you. So, with your dominant hand, hold the ointment tube above the lid margin and apply thin stream or ointment evenly into the conjunctiva from inner to outer canthus. And make sure not to touch the opening of the tube with the patient's eyelid. So, after instillation, instruct the patient to close his eyes and roll his eyes. So, sir, pwede mo piyong, then matap, then roll imong eyes. Okay, thank you, sir. Then, if there's any excess medication in the eyelid, so wipe it from inner to outer canthus, and it is important to have another dry cotton ball. So, discard the first cotton ball. Discard in the waste receptacle. Then, get from inner to outer canthus. And then, don't forget to discard the dry cotton ball in the waste receptacle. Then after that, position the patient comfortably. So, sir, position ang tatarong, sir. Okay ra ka, sir? Comfortable kasi yung position ron? Ha? Thank you. Ako ni sir, ha? And then, assess the patient's reaction. So, sir, how do you feel?
I'm okay.
So, have you feel any pain during the procedure?
No.
Thank you. And then, don't forget to impart health teaching to the patient. So, sir, it is important to eat oranges and other fruits containing vitamin C, which is the key for eye health. So, the vitamin found mainly in fresh fruits and vegetables contributes to healthy blood vessels in your eyes, and it can combat the development of cataracts. So, did you understand it, sir?
Yes.
Thank you, sir. Thank you so much for your cooperation and time. And have a nice day.
Thank you, nurse.
Don't forget to do aftercare to promote sense of well-being and to maintain cleanliness. And lastly, do documentation, including the special interventions you have done to the patient during the procedure to provide good clinical communication and to prevent from any errors.